Hi, everyone. Welcome back. This is Kara with the People's Harm Reduction Alliance and co-founder of the Harm Reduction Doula Collective. And I am making this video about knowing your rights and understanding informed consent as a perinatal person who uses drugs. So let's talk first about what informed consent is and what the right of refusal is. So informed consent is a right to have been informed by your provider, to have had a discussion with your provider about the risks and benefits of a procedure, what is being done to your body, the reason it is being done, and an opportunity to refuse or be offered alternatives to whatever is being suggested. We cannot have informed consent without the right of refusal. The right of refusal just boils down to the right to say no, and the right to say no, most importantly, without consequences. So we cannot have informed consent if there isn't a meaningful way of refusing, because by saying it means that giving a yes isn't really that powerful if you didn't have a choice whether or not you could say yes or whether you could say no. That also goes for feeling coerced into saying yes. So on top of informed consent and the right of refusal, it's important to understand coercion. And coercion is a lot like manipulation. So when you have power, someone has power over you, plus pressure, you're being pressured to do something, someone's exerting power over you. It might be a high stress situation. There's a lot of like stakes involved. It could be, wondering if they're going to call CPS. It could be refusing pain management or something like that. If both of those things, if the power and the pressure equal a reaction that is anything but you feeling like you can stand in your power and refuse, or that you can ask for what you need and have that honored, then that is coercion. Though that power and that pressure is impacting the way that you react and the way that you take action, or even the way that you don't take action in that scenario. So say someone has power over you and withholds information or offers a consequence for failing to do a certain behavior, whether that is going to treatment, taking a UA, leaving the hospital, or like even as simple as like going out and having a cigarette. Well, if you go out and have a cigarette, like you can't come back in, or if you go out and come back in, then, we're going to search you. So they're offering a consequence. If you leave, and like if you leave the hospital, then you can't go to treatment. You have to go straight from the hospital to treatment. So you'll lose your treatment bed. You don't have time to like leave and recuperate. These are some things that I have heard that have come up around trying to offer someone a choice, but also pressuring them or exerting power over them to make a decision. And that's not allowing somebody to freely give their consent or make that decision. So you have in those circumstances, the right to refuse. You have the right to report that staff member or whoever it is that is like exerting power and pressure over you. You have the right to have it documented in your chart. So say that they're telling you, you can't leave, you can't go outside and smoke, or, these things are happening. You can ask to have that documented, because they may be doing these things and not having a paper trail. And when you don't have a paper trail, it kind of becomes like your word against theirs. And it's up to you whether you feel compelled to have that documented or want it documented. But I just want you to know that you do have rights in these scenarios. The assumption of consent is not informed consent. So say you've already given consent to something one time, whether that's like a cervical check or to have your like blood pressure, temperature read. That doesn't mean that every time that they come back in the room that they can just do that without asking. Like they do have to ask you every time they perform a procedure on your body, or they want to take a test or do something. They need to let you know what they're doing, and ask if that's okay with you. And if you don't want to do that, or you need more information, provide you with that or provide you an alternative. And you can say no as a complete sentence. I know it's really hard, especially as a person who uses drugs or who has a history of using drugs because of medical discrimination. And you might think, well, Kara, like, what if I say no? What might the consequences be? And it's perfectly okay to ask them, what are the implications if I say no? What's going to happen if I say no? And if they like don't tell you, or if they do tell you and it's inappropriate or not valid, like having that documented and having them like vocalize that can be a really like powerful tool to be like, oh, they just said that. Like they just said, you know, if you don't do what we want you to do right now, then we are going to call CPS. And it's up to you at that point. Like, is this worth it to me? Do I want to do this or not? But the other thing is, like, if they're just performing a test so that they can collect evidence on you, they're probably going to give it to CPS. Anyway, it's how do you want to control your narrative? How do you want to control what happens to your body? Because just because you are a pregnant person, just because you're having a baby, just because you use drugs does not mean that you don't have human rights. So, what I mean by human rights is like, there are certain rights that we are all bestowed as literally just living and breathing human beings, that are upheld by several lawmaking bodies in the United States, our Constitution. And as long as you are a decisionally capable adult, like you have the right to make those decisions and have your human rights be honored with like full autonomy. So you might ask, Kara, what's a decisionally capable person? And some providers might call this into question if somebody is like under the influence of drugs or something. You are a decisionally capable person unless a court has deemed you otherwise. So unless there is a court-ordered like piece of paper that says that you have a like legal guardian that is able to make medical decisions on your behalf, you are a decisionally capable human being. You can make decisions about what happens to your body and what kinds of care that you receive. And if they don't like that, it does not matter. You're a decisionally capable human being. They cannot just remove that right from you without a court making that judgment. The only other time that there might be like a slight caveat to that is if you are literally unconscious and unable to make medical decisions and they are moving to give you life-preserving care. So let's talk about like what life-preserving care is. Like that's like intubating you, giving like shocking you with an AED, trying to like restart your heart, anything like that. If there is a scenario where you are like unable to verbalize your consent because you are do not have a level of consciousness to do so, they are allowed to provide you that care. What that doesn't mean is like, oh, like this person's unconscious or unable to consent to these like emergency medical interventions. Let's go ahead and catheterize them and collect a urine sample while, you know, we have this person who's incapacitated and tested for drugs. That's not covered. That's not a thing. They are not allowed to do that. Not only is that like a major like violation of so many codes of ethics and hospital policies, it's a violation of your human rights, and it's also a violation of a very important court case called City of Ferguson v. City of Charleston. My bad. Let me review that. Ferguson v. City of Charleston. The court case Ferguson v. City of Charleston went before the Supreme Court, and it set a precedent that you cannot drug test a pregnant person without their consent. They cannot drug test you without your consent. Also, part of being a decisionally capable adult who has a infant is you are the guardian of that infant until proven otherwise unfit. So you get to make decisions about what kinds of care are provided to your infant, to your child, unless the court has removed your parental rights. Once you have had a baby, CPS can't get involved until that baby exists, because they can't have a CPS case. They can't have a child welfare case for a child that does not exist. Okay, so the family policing state, the child welfare state will only be contacted to initiate a case like as you are like giving birth, after that baby is earthside, okay? And you still have the right to make decisions on behalf of that baby. That is your baby. Nobody has taken your parental rights away. So if you do not want to have your baby eutoxed or have them tested, you can refuse that. I'm not going to say that there won't be backlash. I'm not going to say that we can't guarantee like that the hospital will not be upset, but this is an example of how you have the right to informed consent. They need to let you know what procedures they're performing on your baby. They need to let you know what procedures they're performing on you and what tests they're performing. Like if you're giving a urine sample, are they testing for potential like risk factors that could be like an infection? It could be the presence of certain proteins in your urine that could signal a complication, or are they testing for drugs? And you can say, you can test for all those other things, but you're not gonna eutox me. And if they do, then you know that's a violation, and we can report them for that. This brings me to a really important other point, that hospital policy does not equal informed consent. Consent forms at the hospital do not equal informed consent. So you can sign a hospital waiver, you can sign a consent form saying that you agree to receive care. They can it can say all kinds of things. Oftentimes, especially if you're coming into labor and delivery and you're already kind of past the point where you're able to like review forms or whatever, they may hand you these forms after you've already given birth. So there's a little bit of implied consent in that, where like you're coming in, you're about to have a baby, they're not stopping the train from moving. They're not going to have you like go through all this paperwork. You're showing up to receive care, and they're taking that as implied consent that you would like them to help you deliver this baby. But afterwards, they'll have you go through a series of forms. You can, if you're in the state, to like read through all of the forms and like say, you know, I agree to this, I agree to this individually. You can do that. If there's anything that you don't agree to, you can put a straight line through it, an initial next to it, so that it shows on your consent form that you don't consent to it. But even if you do not do that, even if you agree to care, you can always rescind it later. You can always rescind it later. So they might say, you know, oh, well, you signed the consent form, blah, 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 blah. And you can say, I'm rescinding my consent. I actually don't consent to that. And you can document it in my chart. So telling a provider that they can document it in your chart is a really powerful tool, because oftentimes they say like, oh, well, you know, like they don't want the liability. They don't want you to come back and sue, or they don't want to get in trouble with like the their like board certifiers or their hospital legal team if the result of you declining a procedure or declining care has down the road consequences for them or for you. They don't want to have a lawsuit on their hands. So if you feel strongly that you don't want to do that, you're taking that ownership of it and you're saying, document in my chart. Or you're documenting that they're not respecting your rights. Because if you have said no and then they continue to do that, they're not honoring your informed consent, and that's a really big deal. And now there's documentation that they didn't do that. So all of that being said, you know, the hospital policy is just their policy. It's there to protect them. It's there to create certain standards and guidelines. It is not there to override your right to informed consent. And they have to consistently seek informed consent throughout the process. It's never just a one and done thing. It's never just a one and done. They can't, you know, have you sign a form and just be like, oh, we're good, we can do whatever we want. Or, oh, you said yes this one time, so now we're good, we can do whatever we want. They have to continuously check in with you every time they want to perform a procedure, do a test for you or for your baby. You have that right. You are a decisionally capable adult, and you are the legal guardian of your baby. And I want to just like share a quote from the American College of Obstetrics and Gynecology in their ethical decision making in obstetrics and gynecology manual for 2007. Said often informed consent is confused with the consent form. In fact, informed consent is the willing acceptance of a medical intervention by a patient after adequate disclosure by the physician of the nature of the intervention with its risks and benefits, of the alternatives with their risks and their benefits. The consent form only documents the process and the patient's decision. Hospital policy is really not mandatory. Hospital policy is documenting a procedure that is like typically what they will do, and the guidance that they've been given to follow through with. So that's why sometimes when you challenge it, a lot of providers are just so used to people saying yes and going along with it that they're kind of like, wait, what? Like, no, that's just what we do. That's just a hospital policy. But if your hospital policy isn't upholding my human rights, hospital policy does not override my human rights. The last thing that I will leave you with is that it's just like a couple more examples of really common violations, and that's that, you know, providers don't often like come into scenarios and think like, oh, how are all the ways that we can like violate this person's rights? Most of the time they're like unintentional, or they like are just culturally ill-equipped, or you know, they don't have the right like training to understand that what they're doing is not in the best interest of the patient, or that they are doing something that is not in the best interest of the patient because it's what they think that they have to do. So when they keep bringing up hospital policy, when they keep, you know, saying like, well, this is just routine, this is like what we do, like we just need to perform this check, we're under a directive to provide like a UTOX to any person who, you know, has a history of substance use or may have used during their pregnancy, like blah, 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 blah. They may be doing it maliciously, but they may just be doing it because they're scared and they don't know what else to do. And so, letting them know like that you don't consent is like pumping the brakes. It's like, no, like we don't actually have to do that. And if you say directly like you're violating my rights, like I I don't consent to this, like oftentimes it like stops them in their tracks because they're like, oh wow, like I didn't even think of that. So if that scenario does happen though, and they don't stop in their tracks, they don't document, or they don't like immediately kind of back away, you can ask for a new nurse. You can ask for a new provider. You do not have to have anyone on your care that you don't feel comfortable with providing you with adequate care and upholding your rights. So I really hope that this was helpful. Let me know if you have any questions, comments, or concerns in the comment section below. And as always, like I look forward to hearing and seeing you. Keep being you, keep being badasses. You deserve to have your rights honored, respected, and your decisions be wholly yours. So talk soon.